welcome to the next video in the tinnitus treatment video series. So what we're going to look at today is pulsatile tinnitus treatments, and I'll just start off by explaining what pulsatile tinnitus is. It affects 3% of normal tinnitus sufferers, and it is by far the ugly head, I guess, of the condition. It affects a minority, but it definitely is quite serious. You know you have pulsatile tinnitus if you have these symptoms. It's a thumping, whooshing. It's basically a rhythmic sound that's in time with your heartbeat, that's constantly in your ears. And the main difference is that other people that are near you possibly might also be able to hear it. So your doctor would be able to hear it, and would have told you already that you suffer from it. If you haven't seen a doctor, then these are the symptoms to look out for. So the causes of pulsatile tinnitus is basically the irregularity of blood flow, and generally it's people who have a blood flow disorder or have issues with the size of the blood vessels in their neck and head. If you have a certain blood vessel that is either smaller or larger than the other veins in your neck or your head, then that's going to cause the blood flow to be irregular, because it won't be going as fast or as slow as the blood going through your other vessels. Therefore it causes the tinnitus to occur. There are also links to people who can hear the blood flowing irregularly, and then that leads to the tinnitus happening. That's more of a link with TRT, but I'll cover that in another video. Now here are some simple treatments that you can look at. Of course, the first one is very, very basic. If you know where you're affected, so if you know where on your body you have the irregular blood vessels or blood flow, you can simply apply pressure to that area. So if you can try it now if you like. Apply pressure to it, it'll ease up, basically it'll ease the pressure off you, and it'll decrease the effect that the tinnitus has on you. The ringing and the whooshing should die down a little bit, or not be as loud. The other two, you should basically talk with a physician or a doctor about it. So you can use medication to regulate your blood flow, and that's a pretty common method to do, but make sure, please, we stress it, see a doctor first, and make sure you get the right medication. And you can also use physiotherapy with it, or separate from it, because if you are aware of which area needs to either have blood vessels have an increase of blood flow or expand, or whatever it might be, physiotherapy can help you to achieve that. There are other treatments that do link with TRT, neuromonics, and also there are herbal and natural treatments that do help with this sort of stuff, but I'd probably advise just go to our website to have a look at it, because it would, well, I'll be talking for quite a while. So yes, this is our website here, www.treatmenttinnitus.org, or you can follow us on Twitter. Go in there, have a look, read as much information as you can, just to be aware of the symptoms and what you can do to relieve the stress, and yeah, we can do everything we can to help.